Millions of people world over who are diabetics, they observe fast. Statistics says 1 out of 10 people with diabetes, they fast, irrespective of their religion. They could be Hindus who observe fast twice in a month, which is known as Ekadashi. They could be Muslims. They observe fast for the whole month during Ramadan. They observe Roza. As well as other religions also, periodically on and off, they observe fasting. So the question remains whether diabetics, they can observe fast safely or not. As a practicing cardiologist, I tend to see lots of my patients, heart patients, who are diabetic also. And they come periodically to me, especially Hindu patients. They ask me whether they can observe fast during Ekadashi, that is, they observe twice in a month. Muslim patients, before Ramzan, they come and ask me whether they can observe fasting during Ramzan, although they are diabetic, because there is lots of misconception regarding fasting with diabetes. So why fasting becomes a challenging topic in diabetes? Because if you are a diabetic, fasting can cause lots of complication. Especially it can lead on to dehydration. If you are not drinking enough water, especially in hot and humid climate, it can lead on to dehydration and can cause various sort of complications. Along with that, if you are non-diabetic, even if you are fasting, your blood sugar remains constant. There is not significant rise and fall. But if you are a diabetic and if you are fasting, you are not taking any food for a long period of time, as observed during religious fasting, your blood sugar can have a significant up and down. Blood sugar could rise significantly, which is known as hyperglycemia, and blood sugar could fall also significantly, which is known as hypoglycemia, and both could be dangerous. So that's why diabetics, they need to be a bit cautious. But does it mean that the diabetics cannot observe fast? No, it doesn't mean that they cannot observe fast. They can observe fast. But before that, they need to consult with their doctor. In consultation with their doctor, they should undertake the fasting. First of all, doctor should tell him whether he will be able to fast or not. If the doctor gives him a green signal that he can fast, then there are some protocols which he needs to follow. In that protocol, he needs to carefully plan his meal. He needs to adjust his doses, as well as he should periodically monitor his blood sugar. And all those things needs to be periodically observed, and therapy should be adjusted based on his blood sugar recording. So that's why it becomes very important, if you are a diabetic, to consult with your doctor before observing fast. Because if you do not consult with your doctor and start doing the fasting on your own, it could land up in medical emergency also. So that's what it happens with few people who undertake fast without any proper planning, without any proper medical supervision, and they'll land up in medical emergency. So who can observe fast safely in diabetes? Especially diabetics who are type 2 diabetics, and especially those who are well-controlled diabetes. Their blood sugar is controlled as manifested by an normal HbA1c or near normal HbA1c. Those who are not having any complications, like those who are not having a heart disease, not having a kidney disease, or not having a diabetic eye disease, they can observe fast. Those whose sugars are well controlled only with diet or sometimes with minor medication, oral medications like metformin, and those who are not having recurrent episodes of low blood sugar. So if all these criteria are met, then he can observe fasting quite easily, and they are low risk individuals. And these low risk individuals, they can observe fasting, but they also need to be under medical supervision to observe fasting during the fasting stage. Now the question remains, then who should not undergo fasting? Especially those individuals whose blood sugar remains very high, those who are on insulin, that to multiple doses of insulin, those who are having a type 1 diabetes, those who are having complications of diabetes, like those who are having heart disease, those who are having kidney disease, those who are having eye disease, and obviously pregnant diabetic patients also, they should not undergo fasting, as well as those who are having recurrent hypoglycemia, those who are recurrently having low blood sugar level, or on the other hand, those whose blood sugar remains always high. This sort of group of individuals, they need to avoid fasting. Suppose your doctor had told you that you belong to the green zone, your sugars are well controlled and your HbA1c is normal, you do not have episodes of low blood sugar, you do not have any diabetic complication, you can undergo fasting. So what all things you need to look for when you are fasting? Especially you need to look for the signs of low blood sugar during fasting stage. Now what are the signs of low blood sugar? Because this low blood sugar, if you do not recognize it, it could lead on to various very significant complications. It could lead on to even stroke also. So signs of low blood sugar, like first of all, you can see from the glucometer. If the blood sugar is less than 70, you should immediately break your fast. On the contrary, if the blood sugar is very high also, then also you should break your fast. And if you have signs and symptoms of low blood sugar, like you have shakiness of your hands, or you have sweating, significant sweating, or tremulousness, or you have palpitation, you have confusion, you have giddiness. So if all these signs and symptoms are there, it usually indicates probably you are having a low blood sugar, and you should check immediately whether the blood sugar is low or not. And if it is low, you should quit your fasting altogether. So fasting is not that it cannot be done in diabetics. It could be done, but you need to fast smartly. You need to consult with your doctor. You need to have a proper meal planning, a smart meal planning. You need to adjust the medication doses at times in consultation with your doctor. You need to periodically see your blood sugar. You should avoid dehydration by drinking lots of water during non-fasting hours, and you should do it periodically in consultation with your doctor. If you do this, you can definitely do a fasting even if you are diabetic. But the common mistakes which people do is when they break their fast with the excess amount of sweets or refined carbohydrates in the form of bowl full of rice or wheat-based products or sabudana, which are very high in sugar. So rather than going for a refined carbohydrate or sweets or very fried items, you need to have a very healthy plate in the form of good source of proteins, like you can take curd or paneer or egg or other source of non-veg. You can take healthy fats like nuts and seeds. You can take good source of fiber like vegetables, green leafy vegetables, and you should take complex carbohydrate rather than taking a simple carbohydrate. So rather than taking a bowl full of rice or kheer or wheat-based products, you should go for a complex carbohydrate like millets or rajgira or quinoa or oats for that matter. So if you can smartly plan your meal, you can definitely avoid any complication and you can observe the fast quite easily. So key takeaways are that if you are a diabetic, if you want to observe fast because of religious reason, you can do it, provided that you consult with your doctor beforehand. You should monitor your blood sugar frequently. You should adjust your medications. You should avoid dehydration by taking lots of water during non-fasting hours. And if you are having signs and symptoms of hypoglycemia or low blood sugar, you should quit fasting immediately. So it's not that religious fasting, either Ramzan fasting or Ekadashi fasting, you cannot do it. You can do it very smartly in consultation with your doctor. So it is always better that you consult with your doctor who is knowledgeable about the fasting practices and blood sugar adjustment during the fasting state. And if you like this video, you can share this video with somebody else. If you are yourself want to fast because of religious reasons, or some of your family members wants to fast because of religious reasons. And if you like our video, kindly like, share and subscribe to our channel. So you should fast smartly, but you should pray also fully, because both faith and health, they could coexist. In the next video, we'll discuss about which all foods you can take and which all foods you need to avoid before the fasting as well as after the fasting, because it's very, very important to prevent any complication during the fasting stage if you are a diabetic.